everyone, it's Nisha. So today I've got a real treat for you. We're going to be doing Q&As with plastic surgeon Dr. Mark Gorman.
Hello.
Thank you so much, Mark, for doing it. I've had lots and lots of questions. Thank you to all of you for leaving those questions for me. And I think we will go straight into it. So as you know, Dr. Gorman was the one that did my fillers. And you've had loads of questions, so we're going to address those. So first of all, I would like to know, well, I know, but a lot of people don't, the difference between Botox and fillers. So what's Botox?
So Botox is called botulinum toxin, and it's a substance that interferes with the transmission of your nerves to the muscle. So it blocks off you trying to turn the light switch on. It blocks off the cabling in between. It does that for about a 4-month period. And we'll come back to where it differs from fillers. So the whole object of that is to relax muscles, paralyse muscles very specifically. So you inject a little bit of botulinum, knocks out a bit of muscle by interfering with the communication.
And the filler?
And the filler is hyaluronic acid, most of them. There's lots of different substances they can have in them. So you can have permanent filler, which is all the dangerous stuff you hear about.
Yeah, that's very important, because a lot of people think when they hear filler there is this permanent stuff that never goes away and granulates and all that. So that's not the filler we are talking about. Okay. Then there are different thicknesses of filler.
There are, yeah.
And why is that?
So, for a few different reasons. The main reason is just that you want some that are going to feel more like deep tissue. So if you're going to try and create something that's like the jawline, you're going to want a really thick one.
Yeah.
If you want something that's under the eyelids, so it's really subtle and you've got a nice soft tissue there, you're going to want a really thin one. There are consequences that aren't the reason why it's thinner that you take advantage of. So if it's much thinner, if it's a really thin filler, then it's going to drag less water in. A thicker filler drags more water in, and so therefore you're going to get more plumping. So say under the eye, the last thing you want to do is put in a thick filler that you might feel that also drags in lots of fluid, and then actually you've smoothed it, but then you get horrible puffiness.
Because the hyaluronic filler obviously is hyaluronic acid, so it attracts water, so with time you get plumper. So I suppose if you put the thick one, it would attract more water and you can end up with big puffiness under your eyes.
Well, obviously these are things you won't be privy to, but when, like, as a practitioner, you look on the forums and people talk about tear trough, it's one of the areas people are worried about. Not even patients, doctors are worried about doing it.
Yes.
And the reason is, you can often inject at the time and think, I've done a great job, literally on the day, and then a week later someone will come back and go, oh doctor, actually I'm really puffy now where I wasn't because of that, because they put in maybe the wrong filler, a bit too much volume, or maybe too superficial.
So you should have a bit injected weight maybe and see what it looks like before you have
always underdo with when it's under the eye, definitely.
Okay, so always underdo under the eye. Okay, so I had a question if tear troughs are the most difficult places to fill.
Yeah, there's more to it than just that. So when you're looking at so if you imagine, because I do surgical stuff as well, that what's gone wrong with the tear trough, what's created it. So there's a few things. One is that you've got fat pads underneath. Not just one, a few different fat pads. You've got one here at the cheek. So the first thing is this fat pad as you get older, not as young as you are, but when you get old enough for this type of thing, that drops down. So you create a gap between the fat pad that's there and the one that's there. The second thing is that the fat pad themselves swell, or they're almost in little hammocks, and those hammocks can herniate and stretch. And that's why you get, say, the fat pads that are up here, not this one, that stretch to herniate.
It hangs over.
So then you get a double whammy, you get a gap, you get fat descending down here, and this herniating. And so because of that, you need to reverse that process. So you can either do that with surgery, where you make a little incision, you redistribute the fat and smooth it all out, or you can put filler in to support where it's dropped down, or to try and smooth off where this fat pad's sort of stretching, and that can be quite difficult. So how do you do that safely? Where do people go wrong? So people who do it wrong aren't aware necessarily that they're trying to fill specific fat pads. So they're just not aware of it anatomically. And the best way to do it is you actually go under the muscle. So not even into the fat pad. So out here, especially wider, you almost go under the muscle. And I do it with a cannula, so not with a needle, because with the needle you can't really know that you're in the right place. And then above the muscle, as you come in more this way, you go into the very deep part of the fat pad and just smooth that, like I said, it comes down, you
Yeah,
smooth where the gap is.
But also, not everybody is a good candidate for filler under the eyes. Sometimes the bags are so bad that it's just surgery, isn't it?
Exactly.
Yeah.
And especially if you've got loose skin there, you're not going to really correct that with filler.
Okay, because as you know, Dr. Gorman is a plastic surgeon, but we all think of plastic surgeons as just doing facelifts, but they actually save lives. We think of them just as doing facelifts because we are vain, but you do much more than that. So
burns, lower limb surgery, head and neck cancer, breast reconstruction.
wow.
Hand surgery as well. That's one people
Yeah, yeah. I know. I spoke to you the other day, and you said you were sewing back on fingers.
Fingers, yeah.
So he does important job. Okay. So I had specific question, and I think this might be a bit difficult because I suppose you would need to see the patient. But someone asked me, are slight lumps under the skin are normal after getting fillers? How long do they last?
So I wouldn't...
Small lumps. I think she says not visible. Maybe just you can feel it.
So it depends. There's a few ways of answering that. It depends what the time scale is. So how long after you've had the filler?
Yeah.
What sort of filler you've had. My first answer would be no, it's not normal.
Okay.
You should try as a practitioner when you do it. So part of it is where you inject, part of it is what thickness of filler you use, and the other bit is massage. So it's really important to massage it out smoothly. But the thing I say to people when they leave the table is, I'm confident I have massaged and smoothed out any lumps. So any lumps you do feel in the first week would be more due to swelling and maybe the needle mark or the cannula.
Oh, okay.
And then after a week, if you
shouldn't
get them. Yeah.
Okay.
Yeah.
So 1 week it's okay. It could be just swelling or the injection marks, but after 1 week you shouldn't feel any lumps.
Yeah.
Okay. Any downsides of tear trough fillers? Skin too thin, so who can you treat? Because someone was told that they couldn't have filler, that they should have Botox because the skin was too thin.
No, not too thin. That doesn't make sense.
Oh, okay.
No. So the reasons not to have it would be if you have really bad pigment, it's unlikely to correct that. Unless that's shadowing, it could improve it to an extent.
Pigment, you means when there is darkness and like almost greenish.
Precisely that, yeah.
Right.
And it can actually improve it slightly, but it's never a home run result.
Okay.
Rather than it being thin skin, it's loose skin.
Okay.
So if you've got really loose skin under here, it's not gonna help that. So if you've got an eye bag here that's more about skin and less about fat. Remember we were talking about the fat pads moving around, then you're a bad candidate.
Okay, so then it would be just an eye surgery to tighten the skin.
Yeah.
Okay. Can fillers be used for hooded eyes?
No.
No.
So there are some people who describe, so if you imagine, you've got this whole concept of, you've got a sheet, which is your skin, and if you plump it up and you put a pillow underneath, it lifts up the sheet.
Yeah.
So you could theoretically put loads of filler abnormally above your eyebrow.
Yeah, that's what I heard.
And lift it up, but you don't really want lumpy areas above you.
Yeah.
Now, sometimes you can do the same thing if you've got really recessed temporal region.
Yeah.
But it lifts it to an extent.
Oh, okay. Yeah. So no, hooded eyes and
not
fillers.
The first choice.
Not the first choice. Okay. This was really interesting. If you start having fillers done, do you then have to do it for the rest of your life? And I think what people mean, will it stretch your skin so when the filler goes away, you will end up even with bigger bags?
No. It's not going to be worse than it was before. And the process, interestingly, of putting needles in and putting filler in tends to give you a bit of scarring, a bit of fibrosis.
Oh, yes.
So you always, so it tends to get a little bit of tightening, a bit like microneedling.
Yeah, it's like microneedling, I suppose,
yeah.
Because you use needles, you're creating trauma to skin.
You see, especially in the lips, because they're quite prone to, lots of little needle marks.
Yes.
So most people who've had a bit of filler, it never quite goes down to what it was before.
Yes,
you always get a little bit.
And also some people were asking, not a lot, some people have their lips really, really overfilled, maybe.
Yeah. And I think it's shape as well as volume.
Okay.
So,
but when that filler goes away from the lip, will the skin be really loose on the lips? No.
Interesting, the only thing I've noticed with lips is that I think the worst look with lips, and you're talking about overfilled, it's not necessarily overfilled in the lips, it's when they fill above the lip, because then you almost get that kind of...
the trout pout.
Yeah, and people don't know what they're looking at. You look at it and you think, oh, it doesn't look very nice, and it's when because what you really want in lips is height. You know, some people have got thin lips, you want height, but you don't want too much volume.
Oh, okay.
And if you inject too deep, you can then spread without meaning to above. Now, I've seen often like 2-3 years down the line, where the lips have gone down, but for some reason the filler stays a bit more above there.
Oh, right.
And you can often, and then people chase it, and you'll get people sort of going and saying, I just want nice and shaped lips, and they fill them and fill them and fill them, because actually what they're doing is trying to fight against this volume they've got up here that they don't want.
So.
And you have to use higher layers, that's what I've had to do with that, by the way.
Yeah. Oh yeah, so that's
sorry,
another...
it's the thing you use to dissolve it.
Yeah, that's another thing. So, as we said, fillers are not permanent. Your body reabsorbs it, doesn't it?
Because you make HA yourself in the skin continually.
Yeah. And also, if you overfilled or done something that you don't like quite much, you can dissolve it then, can you?
Absolutely,
but it's
100%. And that's, we mentioned right at the beginning, you've got different fillers.
Yeah.
Permanent fillers, which would be like silicone, not literally. Semi-permanent fillers, which some of them have got calcium in.
Never heard of semi-permanent.
Yeah, so people use those often in the hands.
Oh, okay.
You can use them in the nose. Now the danger with those is you can't dissolve them as easily.
Oh, okay.
So if something goes wrong, then if you had an emergency where, for example, you went into a vessel, or there was a big volume and it was occluding a vessel by, what's the word for it? Not blocking in the vessel, but squeezing the vessel down, then you couldn't get rid of it. So that's why I don't like it.
Oh, okay. Whereas...
It lasts along, so that, say if a thick filler, we were saying earlier, a thick hyaluronic HA filler would last up to 2 years max, usually a bit less, then a calcium one may last 3 years.
Oh, okay, so there is no point using
not for the risk factor.
No. Okay, so the HA fillers are probably the best to use.
Definitely, yeah. And the reason, by the way, if just anybody who's interested, why you'd use it in the hands, so why would you use the calcium one in the hands? Given we said it's a bit more risky, it lasts for 3 years. Because hands are an area that can age people a lot, but it's not somewhere you typically think, oh, I'll feel there.
Yeah.
But you can get like in between where your tendons are, you get a real trough. Because you move so often, the more you move an area, the quicker the filler goes.
Yes,
so therefore, putting in a more permanent filler, and there's not really any risks here. That's
and I suppose not going to look odd like you would on your face.
No.
Oh, people want to know what are the latest neck lift procedures.
Non-surgical.
No, surgical.
Oh, surgical.
They want to know surgical too.
Okay, all right. So we'll go right through them. So you've got. So we'll start. So if you start at the simplest and work all the way up. So at the Nefertiti, or the kind of Botox.
Oh yeah, I heard about
that. So people are a bit confused about how that works. So there's two things. One, which isn't strictly a lift. When you do that kind of grimacing thing, and yours is quite nice, but everybody's got it. So you see as you do that, and you've just got these slight lines at the platysmal bands, so they can soften those.
Okay.
And
so that's non-surgical.
That's non-surgical. And going back, that's because, as we said, the Botox or the botulinum toxin interferes with the electrical switch to the muscle.
Yeah.
And this is like one big sheet of muscle, the platysmal area.
Oh, okay.
The second thing it can do is sometimes if you deliberately knock out a bit of muscle that's pulling down, but not the bit that's pulling up, or the other way around, you then get tightening. So on the eyebrows, where people get a chemical lift, Botox lift, it's because you knock out all the muscles below the eyebrow, yet the forehead's still lifting up. So therefore...
That's what I need.
Yeah, but you got it nicely.
Yeah, now I've got it a bit better because...
And you said you had yours a couple of months ago, didn't you?
Yeah.
Of course you don't have Botox.
No, I just look like this.
So on the neck, you have muscles that pull literally, so you've got one big muscle that goes all the way up and it just connects right on top of here.
Yeah.
So what you do is you block it out, you knock out the muscle all the way up to about this point, you leave this bit, and then that tightens around the jaw.
Oh.
So it's subtle, but that's what the neck lift is with Botox.
Okay.
So all this bit softened, this bit's still working, so therefore you get a teeny lift.
Oh, okay.
How good do I think that is? If I was honest, if someone coming to see me and I've been really honest with them, I'd say, if you want a neck lift, this is going to be subtle. You're not really going to probably get.
Yeah, so I suppose a person that wants a neck lift, the neck must look already quite...
That would be a model who was going for like the 5% sharpness, not somebody who was a bit heavy there.
I think we're talking about proper neck lift.
And I think it gets sold that way. The other caveat with it, if you want to get down to the kind of how do you really make a successful treatment, is it doesn't work the first time. So with a Botox neck lift, it's probably on the second or third attempt because it takes a while, and then you get a good result. So some people don't really want to wait that long. So it'd be maybe like 3-4 month treatments, and you start to see the tightness. So
is it the same like with these muscles where you put Botox here for me? So
exactly. The one where so we did the one that stops you from clenching your masseter, and yeah, you're exactly right. You see a bit, but it gets better over time.
Is that because they are such big and strong muscles?
Exactly that.
So you
and
need
it's
more.
different simply stopping a line creasing than it is to reduce the size of the muscle.
Oh, okay.
So it's like going to the gym. It's the opposite. If you don't go to the gym for 3 months and you've been Mr. Universe, you'll still have a bit of muscle, but after a year it'll slowly go down.
Okay, so because you paralyze this muscle, you don't use it so much, so it shrinks a bit.
Precisely. So I don't, because me and you are going to be bad, aren't we, going all over? So let me remember. So you asked me about neck lifting things. So non-surgical. So the next bit is threads.
Threads.
Now we talked about them, and I've said that I teach a thread lift course, but I'll be really honest, I think that again it's a medium level success.
Could you explain what thread lift is though?
Of course. So they're threads that you put underneath the skin. They don't attach to the skin. It's important to get, because a lot of people think you anchor the skin. You don't.
Yeah.
What you actually do is all around the face you've got retaining ligaments, and they're connections that go from the bone or the muscle to the skin, almost so like outwards. And that's what gives you the shape. So you've got some on your cheek, you've got some on your jaw, you've got some around here. An interesting one is the one that causes your jowl. So if I do this, where that pivot point is, that's a retaining ligament, and that's where your jowl comes there.
Okay.
Now, you can take advantage of those ligaments by putting material from, for example, a retaining that you got on the cheek down to the jaw. You can make a little hole, put a thread in with cogs. It stays there. You then massage the fat upwards, and it hooks on. So it's not the skin; it's the fat that goes onto the hooks with the skin over it. Because if you did it onto the skin, you'd get puckering.
And what happens to those threads with time? They dissolve?
Yeah.
Is it like dissolvable stitches?
Yeah. Over about 3 months.
So that lift only lasts 3 months.
It's a good question. So people will argue this. So the way that what's the best way of saying it? So although the thread takes about 3 months to dissolve, it's already dissolving before that point. So it completely dissolves over about 3 months. So how does it hold at all?
Yeah.
The way it holds is after about 2-3 weeks, that skin's been held in that place and it scars a bit.
Okay.
And then the tissue holds due to scarring, not the thread anymore.
Okay.
But once the thread goes, the question then is, well, how long is the scarring? When does it come back? And I would say that you get maximum of about 2 years out of the thread lift.
Okay.
And certain areas like the jowl, often you have to repeat a lot sooner. We talked about that, didn't we?
I suppose because you move your jaw the most.
And it's gravity and a lot of weight. And you get good results in people with quite light faces where there's a bit of skin, but not very good ones in people where there's a bit of fat and heaviness, so it doesn't work very well.
Okay. So what's the next?
So the next one is something that in America is called Kybella, and in this country is called APLASTIC.
Yeah, I've heard my subscribers talking about Kybella.
And you get great results with it. Really good, but it's only just come out. So it's something I want to start using. I haven't done, I've been on one of the training courses. It literally dissolves fat. It's slightly painful, because that's what it's doing.
Okay.
You have to often repeat treatments. But especially if you've got a bit of a pouchy chin underneath, it's great for that. There aren't many things. It's not designed so much to really bring back a jowl. It's more for pouchy little pockets of fat.
Of fat, so it's not so much sagginess, like saggy skin.
No, it's almost, it'd be for people who are a bit weighty, actually. It'd be perfect for them. But with the neck then, really, you're only going to get a home result with surgery.
Yeah, that's so...
you can get an improvement with non-surgical, but if somebody non-surgically promises you they're going to get rid of a really loose neck, I think they're probably lying to you.
So how do you do neck surgery? Is it the neck lift, yeah?
Yeah, there's 2 ways. Often it's combined with a facelift, most commonly.
Okay, yeah.
Because you have to bring tissue behind it, but you can also do a scar or an incision down the middle, and you can bring it together, and that's often nice, especially for people who've got quite marked latissimal bands here, and then you plicate, so that's to say you bring tissue over itself, and you bring it into the middle, and that's quite a nice way of doing it. So
would you say is that possible that someone's face doesn't need a facelift, but needs a neck lift?
Yeah, absolutely.
So that would be okay to just have the surgical neck lift without touching the face?
It would, and in that approach, often it's easier to do it as a midline.
Never heard of that. Yeah. Okay. So if there is no plastic surgeon available, how safe is it to have it done with just an esthetician?
So the main problem is I've got a governing body that we'll answer to. Same for nurses, pharmacists, and
Dentists?
Dentists, yeah. And that's why a lot of the aesthetic training courses will only train those people. If you're a non-medic, though you may be skilled, and there are some people who are great at doing it out there, they've got nobody to answer to ultimately, if they get a complaint, it goes nowhere. So, and even if they get insurance, it's a bit of a weird kind of, like, what are they insured for? Because they're not going to pay out. So you don't really have any recompense if something goes wrong.
So basically, there are some good aestheticians that can do a really good job, but you're taking a risk because if something goes wrong, they are not medically trained to fix it.
And therefore you're not covered.
And then,
because you know who's going to cover your insurance if they're not covered.
Right.
You know.
So yeah, I think we all understand that it's best to go to a medical professional, and the best person is probably plastic surgeon.
Undoubtedly.
But I probably start doing it soon.
Yeah.
I know so much about it now. Have you ever used the filler on a black person? I had a question.
Of course, yeah.
So there is no difference?
No.
The skin colour, ethnicity does not matter?
No, I mean, so the differences are more to do with characteristic face shape. So we did a teeny bit on your nose.
Mm-hmm.
You may have people who have kind of more sort of Arabian noses, and they'll have, and you've got to be really careful not to join up the forehead, because often they'll have a higher sort of dorsal line here.
Yes.
Some cultures prefer rounder faces, some people prefer sharper, so that's more of a difference. In terms of skin colour, that's actually all to do with skincare stuff. So when you're doing laser or things like that, and you do it on darker skin colour, so have you heard of Fitzpatrick skin type? I'm sure you've gone through that with you. So anything from like a 3-4, so that's Mediterranean.
Yeah.
If you do something that is strong enough to take away the epidermis, you can get hypopigmentation.
Yeah, I've heard about that. But fillers are safe for any ethnicity?
Absolutely.
Okay. Have we talked about how long the fillers last?
No, it's a good question. Yeah.
So it depends, doesn't it?
It does. Now, so you'll hear lots of stuff in the industry, like we have special cross-linking, we do X posh thing, and actually nobody really knows because there's not great studies out there, and you can go and kind of look for it. I've looked for them. Even the things that have been out for ages, so some of your viewers who have had fillers for a while might have used Restylane in the past. That's quite a popular one, and that had a lot of research behind it, quote unquote, but actually you delve into it, it didn't really. So what it had was a couple of kind of studies that were done where they'd done them in animal studies or in the lab, and unless you've done big numbers in humans, and how do you even know how long it lasts? Like, how would I measure that? What would I say to you? Exactly. It's hard to tell, you know, it's not very easy to measure.
But what would it depend on? Like, I've heard that if you, for example, work out a lot. Yeah.
So here's the way I see it. And this is my it's the best guesstimate I can give somebody. So you've got different. We said how thick the filler is. So for example, the one I use most commonly, Revelax, which is the one we kind of done some promo stuff.
That's why I had the Revelax.
It's similar to the Juvederm range that people have heard. So you've basically got your thick filler, your medium, your thin.
Yeah.
The thick one lasts up to around 18 months. It can last a bit longer. Like in some of the studies, it lasts around 2.5 years in the nose sometimes. A thin one up to about 1.5 years. A thinner up to about a year.
Okay, I suppose it makes sense when we talked about the filler. The thicker the filler, the more attracts more moisture.
It's that. It's also the rate at which it breaks down. So the way in which it's cross-linked.
So the thicker the filler, slower breakdown.
Precisely. Now the second factor is you said it already. Are you active? So I generally, and this is just a guesstimate, if someone's a proper gym bunny, I'll say take 3 months off those times.
Right.
So if it was 18 months, about 1.5 years. If it was 12 months, about 9. Lips, and the other factor is if people move a lot. So if their mouth move a lot, women never move their mouths a lot. So lips.
No, we don't. Just like that.
Yeah.
So lips don't last very long.
No, because of that factor. So I think if you get somebody who's really truthful with you, they'd say 6 to 9 months.
Lips 6 to 9 months. If you talk a lot.
Yeah.
Mine would last a month.
Yeah, record time. You're better to go from first principles. So fillers are good for revolumizing, contouring. Facials are there to improve the texture of your skin and tighten it, pigment. And they all do that, and that's all they're doing. So if you use a derma roller or microneedling, that's to improve the texture a bit, and you might improve pores, and you might improve acne a little bit in scarring, mediumly. Facials, if you have a really strong peel, it almost gets like a laser, and you may do the same things. You might tighten, you might improve acne. If you use a weaker one, it's just going to be kind of pores and freshening. And
superficial, isn't it?
You know, people talk about PRP and stuff like that.
Yeah.
And how does that work? Nobody really knows. They sort of know that when you combine it with microneedling and you do
Is that the plasma?
So it's basically your own blood.
Yeah.
You're putting a bit
the
of
vampire
platelets.
facial.
Yeah. And again, it just seems like it's like, you know, mesotherapy with microneedling. It's basically that.
Because some people swear by it.
There's no doubt that when you see people who have it, they get really nice kind of moisture retention to the skin, and it does look fresher.
Yeah.
But I suspect it would work with most things. It's not just. I don't think it's the PRP. I think it's the combination of microneedling and a nice product.
Yeah. Combining Botox and filler. Can we do that?
You can in the face, but not in the same local area.
Right.
And we didn't do it.
Yeah.
So we talked about it, and it's a theoretical risk, but there is a risk that you can get an interaction that's dangerous, so therefore you don't. And it's the local anaesthetic in the filler, not the filler itself. Obviously, I use Revelax. So,
and Revelax has anaesthetic in it.
In it,
Yeah.
Now, with that, we talked about your pain factor.
Yes, because there is a question later about the numbing cream and all that.
Cool. Okay.
But what did I ask you first?
We've talked about the fillers.
The Botox and fillers together. So someone comes to you and never had anything done before and wants to have a bit of filler, a bit of Botox. What do you do first? I
would normally always start with Botox. So the average person who comes, usually, say they're in like kind of mid-30s to 40s, you get characteristic aging, which is everything's just dropping a little bit, and around the eyes. So most people sort of say, I want to be a bit less tired and a bit more awake, and in their heads they're thinking, open it up. So you do that first.
So Botox first, and then filler. Yeah. But you wouldn't do it in the same day?
No. Well, you could, if it was in a totally separate area, if it's the forehead to the chin, you could.
So like when I came to you to have the filler, you put Botox here because I wasn't having any filler here.
And again, if we'd have been, so we did the filler from there to there, we weren't even, but if we'd have done, which we could have done, contoured the back of the then we wouldn't have done both.
Yeah. So basically you can't use filler and Botox in the same place at the same time.
Precisely.
Rundown on what and why. The rundown on what and why you did on me.
Yeah. So, how do you set a face? So we've talked about this before. You look at the upper face, mid face, lower face, and they've got proportions both front on, side on. Then you've got what you're trying to lift, wherever you lost volume from. So from your upper face, you'd already had your Botox, you'd had your eyebrows lifted nicely. So that will look nice, there's nothing to do. I think it's still the same now.
You said my eyebrows were a bit too high.
When I saw you last time, did I?
Yeah. But my eyebrows are going down now a bit because the Botox is, slowly.
But it's an interest. But with that one, I won't get lost in what we were talking about. But actually, it's one of those areas that people talk about tear troughs. An area people struggle with is how do you lift the eyebrow and soften the lines above.
Yes.
And the way you do it is you do what you had, which is you do your normal 3 little injections and a little one to lift the brow. You also then do a very small dose, smaller than normal, higher up around here. Yeah. And if you do tiny little doses, you won't knock out all the muscle, you'll soften it. So you won't drop it, and that's the key.
So there is a way, but say you had 3 women with the same wrinkles on a forehead, and you put the same dosage in all of them. Will they all have different effect?
No.
Different result?
It's pretty reliable.
Is it?
Yeah. So you'll get, so people who haven't done a lot of Botox will often say, I really individualise it. You do it in patterns, and then you change that pattern, because otherwise it's not reliable. If you just kind of shoot from the hip every time, so you do it based upon landmarks, and of course it'd be more. What you would say more so is for example, men and women tend to need different doses. Yeah, men tend to need slightly higher doses. If people have got low brows, have you got to be particularly careful about putting a lower dose in the forehead? Yeah, you would. Some people do things like they've got a compensated brow. Do you know that? Have you talked about that?
Yeah.
Yeah, so that's where, for people who don't know, where people walk around like this.
That's me.
Yeah, and then if you put a dose up there, you then actually get a droop that you never had before.
Yeah, so I always complain about it, you know. I have hooded eyes and downturned eyes.
Yeah.
They are a bit better because of the Botox, but normally if I relax, can you see, I don't have, you can't see my mobile lid.
It's honestly certainly not the worst. It's not.
Yeah,
it's
I
there,
know, I
it's
don't
not,
have like the excess skin and everything. That's just shape of my eye, I think. But I have such strong muscles. I talk like this, like I'm surprised all the time.
Yeah.
I always lift my eyebrows. That's why I've got all these lines. But I'm so scared because I've had...
So the key is, so when if you have a surgical brow lift, what you do is you make a little hole up here, you come down, and you need to hook, and you need to literally pull on this part of the eyebrow, and you actually have to kind of free up the tissue. Now, the reason is, if you watch now, if I pull up on my forehead there, it doesn't do much, because it's not translating. If I pull up here, it lifts properly. So the bit that you need to lift up is this 2 centimetres.
Okay.
So if you don't put any Botox in there, that bit will lift nicely, and you can then knock out this bit a bit higher up, and you'll soften that bit, soften the lines, but still allow it to have that lift. It's unopposed, you know, because you...
But how? Isn't it one big muscle, the front?
It is, but if you've got contraction of this part of the muscle, but not that part, you'll still get a nice lift. But you can then soften those lines. So you see the lines that you got up here, we can soften that by just putting a small dose up there, because it only spreads out so far.
Yes.
So if you throw a pebble, and you get the ripple effect, so if I put in a bit of Botox, it'd be the centimetre around, but this bit would be okay, and it'd still give you that little lift.
I don't know.
So
we keep going off.
So we said, what did you have done? So that bit, so that bit of your face is nice.
Yeah, I didn't have anything more done to my forehead.
Now, your cheeks had lost volume.
Yeah.
And you were starting to get a little bit of a teardrop. So we were conscious of 2 things there. One, we wanted to give you more contour, not necessarily loads of volume, but sharpness. But when in doing that, you can accentuate your teardrop. So that's why we planned to say, right, let's give you some contour here, which you do with a cannula. You're saying about needle or cannula. Yeah. So you can go right on the bone with cheek, so you can go a bit more superficial. And I went a bit more superficial with the cannula because you get more sharpness. And the second thing was we didn't want to bring volume at the front of your cheeks, much it was more around the sides to give you sharpness. But then we had to soften this area here, where if we hadn't have done that, again with the cannula, you may have had more of a teardrop. In fact, you would have had more of a teardrop.
Right.
And actually it looks better now than it did before. So we've got your contour and we've softened that a bit.
That just shows there is so much more to it. It's not like, oh, I have these lines, so I just go and have it injected here. That's not how it works. You have to really plan, see what you want to improve, and really plan where, how, and what to inject. So
absolutely, and also discuss it properly. Because you know, I can think I've got an idea in my head, and we'll come to that because I think there's one bit I think we've got everything spot on. And the bit we talked about was the generic, and it's thinking about, okay, it's how you manage what you think you want and what you're going to achieve and the planning ahead. And then the last bit, as you were saying, was the reason we raised the cheeks was it softened these lines rather than injecting straight onto them, and it softened this area by lifting. It
almost like gives a slight facelift.
Yeah.
The whole thing has lifted up. Look at my cheek. I know I've got like blinding highlight on there, but it's good.
And the last bit then was with the chin. So it was what we wanted to do was it's the proportions again. So there's a lot to it, but to sharpen this area and get rid of the gel, what we wanted to do was bring your chin down so that the distance from here to here was longer, but not bring it out.
Yes.
Now, how do you do that when you're injecting? If I go onto your chin and I inject, if I go at 45 degrees, it will bring it out that way. If I go at more 90, it'll come this way. If I go right underneath, it'll bring the chin down. So that's what we tried to do. Now, the volume that's here, I think most of that was actually from the previous time.
Yeah.
But what I didn't, and what the other thing we wanted to do was when we looked at photographs when you were younger, you had a bit of a gap here.
Yeah.
And the jowl was accentuating that, so we wanted to smooth this area without adding volume to the chin.
Yeah.
So we did all that, but I think we achieved all that nicely. It's sharper, but what we probably didn't achieve, because we weren't necessarily aiming as much, was to thin the chin.
Yeah.
And I think next time when we do it, let that settle, we bring it more to a point so that the width of the chin is narrowed.
Yeah. Oh yeah, someone asked, what about permanent fillers?
Not a fan.
Not a fan. Are fillers good for acne scars?
They're not brilliant. And the reason is that you have to have something really thin, really thick to actually fill it out, and you know, fillers aren't that.
So better thing is like laser treatment, isn't it?
Exactly that, yeah.
Do fillers work in 11s?
So the first thing to say is it's quite dangerous there.
Oh.
Yeah. And the reason it's dangerous though, we talked about
necrosis.
Yeah. Now, why does necrosis happen? It happens where you've got end arteries. So if you think of the face of the motorway, you've got roads that just end and you've got dead ends. So here you've got vessels, the supratrochlear vessels, and they're end arteries. So if you block an artery that's here, the tissue above it, there's nothing else supplying it. It doesn't have a collateral supply. So if you block that bit of tissue can just die. And you can, if you look at pictures on Google, you can see
I've seen it.
So the first thing to say is, it wouldn't be my first choice. Could you do it? Theoretically, with a cannula, being really careful, you can. But generally, it works really well with Botox.
Yeah,
so I'm not sure why you would.
Yeah, but I think because some people say if you have like really prominent lines here and quite deep because you've never had Botox and you've always been, I can't frown, then Botox won't work.
Generally, I would say it softens it enough for people. In 99% of cases, they're happy. So the two scenarios where you might still want filler would be A, you've had Botox, let's say, for a year, you haven't had it like wear off, you've had it every 4 months, which is about optimum, so that it's had a nice time to rest, and it's still an indentation you don't like. That would be an indication, and you discuss it.
But it's a bit risky.
It's risky, and I can't think of the last time somebody who'd had Botox for a period of time who also wanted filler. Usually Botox is sorted out.
Okay, so say I've never had Botox, I have quite deep 11s, and you put Botox there, so the first time it's not going to get rid of the lines.
It'll improve but it may improve over time.
Okay, so if you keep doing it because the muscle again will relax and
Exactly. Now there are some people who, and this is the other argument where people say preventative Botox.
Yes. Oh yes.
So, and that would be a case. So have you creased your frown area so badly that despite resting it forever, it's still there and you're not happy, and that can happen. And that's the case where you might want filler. The second case is people who just don't want Botox and they only want filler. You know, they say to you, actually I want to keep all of my expression, but I've got some lines here that I want filling. Usually it doesn't work very well.
Okay.